everyone, it's Dr. Ellie here with my pod, I Heal Kids. And if you don't know me, I take care of children 0 to 21 as a holistic pediatrician. And I also do functional consults for kiddos 2 to 102. And I'm here today with, guess who? Stephen Kempler, who is an amazing occupational therapist. Thank you so much for coming today.
Thank you. Yeah, I really appreciate the invitation.
Yeah, you're so welcome. And a little about him, you guys. He was born in New York. He's raised in Central Florida, so all over the place. Not only that, graduated with a degree in kinesiology from UCF, not UCSF, UCF, and has a master's in occupational therapy from University of St Augustine. He's worked as an occupational therapy in skilled nursing, hospitals, schools, private practices across multiple states, California, Colorado, Oregon, New Mexico, and now here with us in North Carolina, if I can speak today. And not only that, he's an amazing human who also loves hiking and still loves to play soccer and volleyball. So I'm guessing if you need either an occupational therapist or an extra for your soccer team, he would be available in or around Asheville, North Carolina.
Absolutely.
All right. Well, welcome.
Well, thank you very much for that lovely introduction. I appreciate that very much.
Oh, of course. I mean, the skill set that you have for, for anywhere, but also just that you can offer in like this smaller town versus, New York City. We're so lucky to have you. Okay, I just want to jump right in because honestly, and I think I had this question too before I went to medical school, like if you're not familiar, what is occupational therapy and like how does it even differ from physical therapy?
So I think that is actually a totally cool and question I get asked all the time. It's occupational therapy, I think, has such a broad scope and looks so different amongst different settings. It can be a bit confusing to a person that hasn't really been directly exposed to it or have done some of the higher level medical training that has been too familiar with it before. The big difference, we'll focus on like the pediatric side of the difference today because it does vary again still when you get into the adult side of things. But the big difference, because physical therapists are also amazing as well, if we're thinking about babies and children, particularly for physical therapists, when children are experiencing differences in their strength, balance, gross motor coordination, they really use this excellent lens of kinesiology and have a deep understanding of anatomy and physiology. And they use those skills to help children kind of meet those motor milestones and things like that when they're not quite able to achieve it. They also do that in the sense for children that have experienced some form of like injury where they need that rehabilitation to regain that strength and coordination. Now, the big difference between occupational therapy and physical therapy is really that lens of how we look at the kids that we work with. So in occupational therapy, we kind of have this concept of looking at the whole picture. We use a combination of approaches that can be based in anatomy and physiology, similar to PT, but we also use that piece of the psychosocial, cognitive-based training. And our main goal is to ultimately help children and their families achieve meaningful goals to them, to become proficient at the things that they want or need to do to be successful at all aspects of their life as possible as they can be. So it's kind of just this big picture where we get to tie in expertise from all different sides of the coin, and the physical therapy side is a little more specific in how they approach helping kids.
Okay, that makes sense. So from what I'm hearing, so physical therapy is very specific for, like, for example, if a kid is having trouble learning to walk or they've suffered a brain injury and now they're having trouble moving their left arm or something like that. And it's difficult for them to regain that function or get that function. And so that would be for physical therapists.
Correct.
But on the occupational side, it's more about a holistic view. Yeah.
Absolutely. And the one caveat I'll add for that example you just shared is, sometimes like for that brain injury, for example, there is this like limitation that might, depending on the level of severity of the injury, that there can only be so much physical function regained. And so even in that scenario, an occupational therapist might come in and say, hey, we need to develop some compensatory strategies or assistive technology devices to really help figure out what's going to make this kiddo be as functional as possible as they go forward in life.
I see. So if there are limitations that might maybe not be able to be surpassed or regained, then we have to figure out, like, how do we function in our world with those concerns?
Absolutely.
Okay. Amazing. Well, I know that I happen to know from meeting you before that you actually have a specialty in SOS feeding therapy, which
Yes.
I know my parents want to know more about, because feeding is, and you know this as well as I do, everyone is like, well, feeding can be easy. Feeding can be stressful, and there can be a lot of challenges depending on the kiddo. If you could just explain, like, what is SOS feeding therapy? How does it differ from other approaches? Who would benefit? All of that good stuff.
Yeah, so SOS feeding therapy, which stands for, it's kind of SOS is a great acronym for it, because what it actually stands for can be a little overwhelming, but it stands for sequential oral sequencing feeding therapy. And it was designed by an amazing psychologist named Dr. Kay Toomey. And she kind of works in a collaborative model out in Denver, Colorado, with occupational therapists and speech therapists. And she kind of took that knowledge from what she learned from OTs and SLPs to kind of develop this program where she figured out that if we think of looking at integrating the senses, the oral motor, the behavioral, and even the nutritional aspects of feeding, and with this process of gradually exposing children to new foods in this sensory-based hierarchy in a playful, non-threatening approach, it is extremely successful at helping kids bridge the gap of just really being stuck on those limited foods they're willing to eat. Now, there are a few other feeding-based approaches that are used by both occupational therapists and speech therapists and some psychologists as well. And they have slightly different angles of the approach. There's 2 or 3 in particular I'll mention briefly, but one is called the Beckman Oral Motor Protocol, which that is much more focused around the actual physical oral motor development skills around the mouth. I've used aspects of that before, particularly for like babies that are having trouble with latching and bottle feeding and things like that. And it's really highly effective for that kind of feeding challenge, but doesn't necessarily help with that sensory anxiousness-based picky eating. Now, the other two, the get permission approach and eating with ease approach, are both a little more child-led and working more directly with the picky eaters. But the get permission approach is really much more focused around just like decreasing the anxiousness and taking the pressure off. And the eating with ease approach uses a couple aspects of that, but also ties in a little bit more of some of what Beckman does, which is this neuromuscular re-education of the oral motor muscles of the mouth, which can definitely involve like kids that experience tongue ties and things like that, where is definitely a prevalent thing in the kids we work with. So what I have found is that the SOS approach pretty much takes pieces of a lot of these concepts and has melded them together into a really beautiful style that I have found the most effective when I'm working with kids that have these eating differences.
Okay. So let's make sure that
I know. Sorry, a lot of information. Yeah.
I love it. I think it's so valuable and so impactful. And I think it's going to help, me and, so many parents. And just to make sure that we've all got it. Okay. So SOS is sensorial. Say it again. Sensorial. And what's the OS?
So it's sequential.
Okay.
Oral sequencing.
oral sequencing, sequential oral sequencing. Okay. And from what I understood, this is more to do with sensory processing issues. So like, would this be, kiddos who are struggling or experiencing autism or do identify as autistic, who are having trouble with like textures and flavors and things like that? Or does it expand into almost anyone who's having feeding trouble, like picky eaters and things like that?
Yeah. So, one thing we know for kids diagnosed with autism spectrum disorder, or, even the, suspected ones that might get a diagnosis later on, one of the diagnosing factors in the DSM for that is a sensory processing related issue. And so that could really stem from, you think about your 5 basic senses that we all learned about in school, that each one of those are on their own spectrum of how we interpret that sensory input. And for kids, that tends to be the starting place that starts to deter them from certain types of foods, such as like the texture or the smell, or even how the food looks. I always make the joke to the kids I work with, when I was a kid, if food was the color green, I just assumed it was poison, and there's no possible way that I would come anywhere near it. It could be a delicious green grape, but I was like, nope, that's not an option in my world. So I can totally relate to these kiddos that are having kind of this rigidity around it, because these sensory sensitivities start to influence more of that emotional regulation side of the coin too, and cause that kind of just total dysregulation, overwhelmed feeling. It could stem from that anxiousness of like maybe past experiences of being pressured by various adults, or even in the most ideal scenario where parents and caregivers and adults around them are really cool, calm, and collected around exploring new foods, but their own internal sensation and nervous system gets so dysregulated around the idea of like, what could this taste like? Is it going to be this really big, overwhelming taste or texture that my body isn't ready for? Is enough to kind of make that just quickly become habitual, where it's like, hey, next thing you know, we're only eating 10 or less foods, which can be quickly incredibly stressful for parents and adults around these kiddos.
Yeah, I have seen this a few times in my practice. In fact, last year I recently worked with a teenager who had reduced to 4 foods, and all of them were white. And it was actually really stressful for him. I believe he did end up getting a diagnosis of autism spectrum, among other things, but it had actually reached a point where he himself was just really embarrassed to go out with friends because he couldn't order out. So it's definitely a psychosocial component later on as well. And then, of course, like the younger kids, it's just so stressful when you just want your kid to eat. And you're like, are they going to literally die because they're not putting food in their mouth? I mean, that's just overwhelming in my experience for parents.
Your baby's birth should be a joyful experience. And with the right knowledge, it can be empowering too. If you don't know me, I'm a holistic pediatrician at Middle Path Peds in Asheville, North Carolina. In this free webinar that I'm so excited to share with you, you'll learn how to make informed choices about newborn care, from eye ointment to newborn screenings to when to give baby that very first bath. We'll also go over reducing environmental toxins and supporting your baby with whole food nutrition, all to give them the best possible start. You'll leave here feeling confident and informed and ready for those precious first moments. If you want to nurture your body for a healthy pregnancy, feel empowered in your newborn care choices, and learn holistic ways to support your baby's health, well, then this webinar is for you, and I invite you to join. Feel prepared, feel confident, and feel ready for your parenting journey. So click to join us for the free webinar. I'll be happy to see you there.
Absolutely.
I wanted just to and I'm so fascinated and so happy to hear about that you can work with infants who are having trouble latching and their oromotor skills. I was curious, could you give an example of like if a mom came in or a dad came in with their kiddo with those issues, like what kind of things would you do for them?
So for the latching and bottle feeding piece, it's really fascinating because there's a few strategies that I have found that I don't like to say quick fixes because every kid is different, and
Yeah.
but there are a couple things that require just the small adjustment, and we see a lot more success around those babies and infants. And in particular, it is taking some of those oral motor and sensory aspects. There are some different techniques of using our fingers or a tool to basically stimulate around the lips and even on the inside as well. That actually helps wake up that part of the face, because one of the more common problems is we have these primitive reflexes as babies that help us root, suck, and swallow is kind of the go-to reflexes. It's one of the things that maybe we'll talk about later on, of like, is eating an instinctual thing that we do, or is this something that is a more of a learned skill behavior? And in the infancy stage, it is instinctual. We are born with these reflexes that help us, but that doesn't mean it's always a perfect system. So a lot of times the first thing I look at is, what does the seal look like, whether that's around the nipple or the bottle. It's if we don't have that perfect seal where we're blocking off the air from coming in, we're likely going to see a challenge. And so sometimes doing some of this oral stimulation really helps with that. But I also say just something as simple as positioning when we're doing feeding can make a big difference too. And then, of course, that other OT angle that we look at, as I'm sure a lot of moms know, there's quite the variety of different kinds of nipples on bottles and things like that, and how big the hole is for where the milk is coming or formula is coming out of. And so there's a lot of ways to kind of explore and problem solve together, that in an evaluation, I kind of go through all those areas and see if I can kind of pinpoint down that maybe it's just one of these small things that we can try to adjust and increase or decrease the flow. Or and then, of course, as I'm sure a lot of moms know, there can be a lot of stress and pressure when it's not going well. And
Yes.
one of the things that I love to do is that parent education piece, because it's important to recognize it's hard to do anything when we're stressed and really putting pressure on ourselves. And it's close to impossible to be successful sometimes if we can't be in a calm, regulated state ourselves. It's one of those things where I say, like, our nervous systems are contagious. It's just like the flu. If we come in a room with big energy, we're probably leaching that out onto others around us. And I think that same thought process applies to a mother and a baby as well. It's really important to be in a good state when we approach these things, and there's lots of ways we can support that as well.
Yeah, we actually just did an episode with a therapist and parent coach who works specifically on emotional regulation of parents to assist with parenting, because oftentimes
I love that.
it's
I love
us
that.
and there's stuff from our
Yeah,
past that we have to like work through, figure out traumas, all the rest. So I'll link that as well. I'm really excited about this concept of waking up the mouth, because I do have a lot of kiddos that come in with tongue ties. In fact, recently I worked with a family that had multiple tongue ties. This poor mom was in a lot of pain. The baby was very bitey. Lots of milk was coming out of the baby's mouth, swallowing lots of air. And they did have to do some tongue tie release. But I do think that this is, helpful to have the follow-up as well. And so good to know that that's out there. I also wanted to just touch on this idea of taking the pressure off. I have seen this a few times for people just that I haven't referred, but it's just been kind of a dynamic that's happened where, understandably, people want their kid to eat. And then it becomes like eat. And then the kid is like, no.
Yep.
And it just becomes like a little bit of a dynamic. So sometimes in those situations, I just recommend, just leave some food out, a variety of different foods, some that they like, some that they might be challenged by, and just kind of see how that goes. Is that what you would recommend in those scenarios, or would you do something different at that point?
That's a great general approach to it. I always talk about with the families I work with, because a lot of times there's like a kind of a habit that forms on the parent side of things where we identify the foods that they're always comfortable with eating, but then we stop putting out those foods that might be semi-preferred or novel or even non-preferred. And I always say it's like there's a 0% chance we're eating something that's not actually on the plate or on the table. So
Mm-hmm.
it's important to have those things still out and around, because, as we talk more about this sensory hierarchy and exposure of foods, a big part of it is just the initial tolerance of being around these foods. That is literally step one of this SOS approach, is can we tolerate even being in the same room as the food? And
Mm-hmm.
so having that out on the table, taking that pressure off in whichever way works well for the family, which I think is incredibly important to always keep in mind, because every family is so different. Every person, every dynamics, every mealtime looks so different from household to household. And so giving some just, gentle advice like that to say like, hey, just, put the stuff out. There's a good chance they'll gravitate towards it and eat some of it. And I think that's a great starting place if you're just kind of like exploring on your own. And then, of course, there is this more guided approach that's like a occupational therapist might be able to provide to kind of keep, one of our go-to phrases in the OT world is, how do we create the just right challenge? And so that is really what the SOS approach is all about. And so it's great starting out like how you just suggested, and then there's ways we can build on that from there.
Oh, perfect. So if that's not working, then seek professional help. I hear you.
Yes.
I hear you on that. This is so fascinating. And I'm just wondering, maybe we can step back and just talk about your journey a little bit.
Sure.
What drew you specifically to learning about SOS and specializing in feeding therapy? How did you end up in
Yeah.
this world?
So personally, when you graduate from occupational therapy school, you are definitely in this generalist category. We have several handfuls of classes in all the different areas, because we do come out of the gate being like, are we going into the adult world? Are we going into the pediatric world? And then all those variations. I had a really great internship in the pediatric world that totally made me gravitate towards that. And I knew that was meant for me. And as kind of the years went by, I started to notice this upward trend in more specific picky eating referrals. It's
Mm-hmm.
really interesting when you talk
Me too.
to, yeah, I'm sure. And it's really interesting when you talk to, I'm sure, other like older pediatricians that have been doing it for 30 or 40 years, older occupational therapists that have been doing it a long time. They do see these kind of trends of different referrals kind of coming in. And this picky eating one seems to be a pretty big one coming through the doors right now. So
Yeah.
as that started, a couple of my colleagues, this is actually when I was in Colorado, and because Dr. Toomey, who started the SOS program, is Colorado based, she does the continuing education to start getting trained in it in Denver. And so a couple of my colleagues went, and I immediately saw there like a whole new train of thought process of how they were approaching it. And I was so fascinated by it. I was like, if I want to be the best possible occupational therapist I can be, this has to be something I start to learn and understand more about. So, to be honest, it wasn't necessarily something that I had an innate passion to jump into, but my overall passion of just being the best provider I can be led me into it. And then just this repetition of experience and working with, 100+ different families
Yeah.
and
Yeah.
things like that has helped me kind of fine tune it and really start to become, a standout person that can support families and children with this challenge.
Oh yeah, 100%. I get that, because I think a lot of us in healthcare, we start out in our, wherever we start. For me, it was conventional medical school. And then from there, you just kind of develop your skills and you learn, or you grow and you say, okay, this is an area that I really want to get into, or I think is really important. For me, it was integrative medicine, functional medicine, and
Yeah.
all of that on top of the the pediatrics that I had already learned. Please join us next week for part 2 of this pod with occupational therapist and SOS feeding specialist Stephen Kempler. In this next episode, we cover when to seek help for feeding issues, understanding the 32 steps of eating, misconceptions about feeding therapy, and success stories. So I'd love to see you there.
The moment you welcome your baby into the world comes with many decisions. Do you want to give eye ointment, delay the first bath, choose newborn screenings, or do a circumcision? The truth is, many parents arrive at the hospital or birth center unprepared to make these choices. And beyond birth, there are key decisions about reducing toxins from the environment, improving nutrition, and supporting your baby holistically. If you don't know me, I'm Dr. Ellie, a holistic pediatrician at Middle Path Integrative Pediatrics in Asheville, North Carolina. And this free webinar empowers you with knowledge before the rush of labor and delivery. You'll walk away feeling confident and ready to make the choices that align with your values. If you want to nurture your body during pregnancy for a healthy start, feel confident about making informed choices about newborn care, learn holistic approaches to support your baby's health, then this webinar is for you. So join us to feel empowered, prepared, and supported as you welcome your new baby. Click below to reserve your spot. Wishing you well.